on tonight, stopping opioid addiction before it starts. Community members and leaders from across Western Massachusetts were in Greenfield tonight to learn how we can stop the growing opioid epidemic.
There's just amazing work that's going on in Franklin County right now.
Opioid addiction is on the rise, and Western Massachusetts communities are hoping to put a stop to it.
From the government, from the community agencies, from the hospital, from education, from the police, from the courts, all of these different groups have all come together in this community to work on this very difficult problem.
Thursday night, the Opioid Education and Awareness Task Force, along with Dr. Ruth Pody, explained safe prescription practices to a room packed with local doctors and prescribers.
Oftentimes people think that because it's been prescribed by a doctor, then therefore it's safe. It's not safe to share. It's not safe to take longer than you've been prescribed it. Those kinds of things put themselves at risk, but it puts the community at risk.
Hebel says one of the biggest factors in the opioid crisis is overprescription. The Centers for Disease Control and Prevention says doctors wrote 259 million prescriptions for strong, potentially addictive painkillers in 2012. The task force says if a doctor does prescribe you opioids, keep them locked up. 71% of people who have prescription opioids say they got them from a family member or a friend. The director of Health and Services with Northampton Public Schools says we're seeing opioid addiction start at younger ages. She said the earlier you pick up a drug, the more likely you are to develop an addiction.
After oral surgery or orthopedic surgery, those are two of the biggest times that we see adolescents prescribed opiates.
Vance recommends parents monitor and manage their child's medication regardless of their age. If you want to learn more about safe opioid prescription practices, or if you're looking for ways to get help, we have that information up on our website, wwlp.com.